Hi again, and welcome to this brief overview of how to use equipment safely. As a nursing assistant, you use equipment that makes your job easier and helps to ensure the safety of the people in your care. But because most equipment has moving parts, you can be causing some serious injuries if you do not use it properly. So before using any piece of equipment, be sure you understand how it works. Read the user's manual and follow instructions exactly. Instructions for use may also be located on a sticker or a label attached to the equipment. And before using any equipment with a person in your care, be sure to practice using the equipment under the supervision of someone who can provide guidance and really validate that you are using it correctly. Even if an experienced coworker validates your correct use of a piece of equipment, if you don't feel completely confident, ask a nurse for help rather than risk injuring yourself or the person in your care. You will use wheelchairs frequently when caring for older adults, and like all equipment, wheelchairs need to be used properly. The brakes or locks are an important safety feature. Always check that the locks are working properly before using a wheelchair. Let's look at some do's and don'ts for nursing assistants for transporting a patient safely in a wheelchair. Do have the person rest their feet on the foot plates. Do walk on the right side of the hallway. Do turn the wheelchair around and walk wheelchair ramp backwards with the person facing uphill. Did you know that this actually decreases the risk of the person tipping from or with the wheelchair, resulting in injury? Do enter and exit elevators backwards. This helps to prevent the small wheels on the front of the wheelchair from getting stuck in the crack between the elevator and the floor. Do use caution when walking past doorways and around corners and at hallway intersections. This helps prevent you from bumping into other people. Do take care not to bump the person's arms or legs as you are passing through doorways. Do lock the brakes if the person will be standing up from the wheelchair so the wheelchair doesn't move. And do lock the brakes whenever the wheelchair is stopped. Lastly, do check with the nurse before ever leaving a person unattended in a wheelchair. And lastly, we have one don't. And that's don't lock the brakes if a person cannot unlock the brakes and is in a situation where the person should have freedom to move around in the wheelchair. This is very important when we start talking about restraints. So let's move on to safety when we're referring to side rails. So beds used in healthcare facilities may be equipped with side rails that can be raised to prevent the person from falling out of bed. Some people may also use raised side rails as an assistive device for repositioning themselves in bed. However, today the use of side rails is becoming less common because side rails are again considered a form of restraint, which you'll learn more about later. In addition, side rails can cause serious injury, and a confused person may try to climb over the side rail and fall. What we're going to talk about here for a minute is entrapment, and it's a concern when side rails are in use, especially with older people who are confused or disoriented. In entrapment, the person's head or another body part gets trapped between or under the side rails. And what you're looking at here are 7 danger zones in a typical hospital type bed. So just be aware that there are many entrapment zones within a hospital bed or a bed with side rails. And more we are moving away from using side rails because they are considered a form of restraint. The best use of side rails is one side rail that will help your patient reposition themselves and feel stable in bed. But they have the ability to get out of bed on their own if that's what they're capable of. But be aware that you still have all of these zones within one side rail having up. So be safe.